We are talking about breast cancer treatment in Finland today and also about breast reconstructive treatment. And I'm happy that Clinic Helena from Finland again with us, because before COVID it was very popular clinic for international patients. And now this clinic also open again to receive international clients. And I'm happy to introduce our speaker. This is Ina Aladina. She is patient coordinator, and she will explain us how this clinic work and how we can cooperate with. Hello, Ina.
Hello, Natalia. Thank you very much. I hope that you can hear me well. And I thank you very much for inviting Clinic Helena for this webinar. And I want to thank the listeners who arrived to listen to our presentation. Thank you for your attention. Beforehand, yes, as Natalia has already said, Clinic Helena is a clinic in Finland. We are located in Tampere, which is the second largest city in Finland after Helsinki, the capital. And this beautiful lady here on the first slide is Helena Puonti herself, the owner of the clinic and the leading plastic surgeon of Clinic Helena. She's supposed to speak in front of you today, but she had an emergency here in the clinic, so she's treating a patient right now. So she delegated this task to me. I'm a patient coordinator and kind of a field worker here, so I work directly with patients, starting from the first contact, either from the patient themselves or from a medical agent who delivers the patient. I accompany the patient throughout the whole treatment process till the end. And this is my work. And I've been working in Clinic Helena for 8 years. And hopefully I can also answer the questions after this presentation. If I can't, I will deliver the questions to Helena Puonti and she will be happy to answer. But okay, let's get back to who we are, what we do. As Natalia said, we have been here on the market for a very long time. Helena started this clinic in 1999, her private practice in another city of Savonlinna, and then we moved to a bigger city of Tampere. And initially, Clinic Helena was founded to provide breast cancer treatment and breast reconstruction surgeries for foreign patients. Because here in Finland, people have access to high quality treatment, even in public sector. Although we have also private clinics. But we also have capacity to provide our services for patients from abroad. We have enough language skills and other skills to provide good treatment for and best service for our patients. We speak English, we speak Russian. Helena herself, her mother tongue is Finnish, of course, but also she speaks very fluent English. So also we cooperate with interpreting companies, so we can arrange an interpreter for basically any language you can think of. We specialize on breast cancer treatment, primarily for surgical treatment, for the surgical part, for the surgical stage of breast cancer treatment, and especially for breast reconstructions. We also perform all necessary breast cancer diagnostic here in our clinic. So if it is the case when the diagnostic is still unclear, or it is the case when the diagnosis is absolutely clear, we can start treating the patient. But first we will need to have the opinion of a Finnish oncologist to confirm if some treatment has already been set somewhere abroad. We want a Finnish oncologist to confirm that everything is right and everything is done according to the Finnish protocols of cancer treatment. I would like to start with breast conserving surgery of breast cancer. Here's one example. Here, hopefully not too shocking pictures. In most cases in Finland, when a woman is diagnosed with breast cancer, we can perform breast conserving surgery. It means that we do not remove the whole breast, but we remove only the particular part of breast containing this lump and some margins into the healthy tissue. And then, depending on the situation, we perform oncoplastic surgery. In this case, it is very important that the plastic surgeon is experienced and knows how to perform tailor-made, or actually all those breast conserving surgeries are tailor-made. It means that we consider the particular case and we see what size and shape has the breast of this particular patient. And Helena Puonti, our leading oncoplastic surgeon, makes a plan of the surgery so that to keep the symmetry of the breasts. So when we have to remove a particular part of one breast, sometimes it is enough that to the other breast we perform mastopexy, or we can make a breast reduction, or we can use some other techniques to obtain symmetry. Just some more information about Helena Puonti. She has a very long experience as an oncoplastic surgeon. She became very interested in breast, especially breast surgeries in early 80s, and she started to develop her own very specific method of breast reconstruction in 1991, I think. Yes, after she became a specialist in microsurgery. During different stages of her life, she was a head plastic surgeon in municipal hospitals, for instance, in the cities of Savonlinna, as you can see here. And now she moved to Tampere and continues her private practice here. But actually, the main thing in her career is this PhD degree in 2017 for developing her own method of sensing breast reconstruction that is based on a quite well-known method of TRAM reconstruction, but it is developed further to restore nerve sensibility in the reconstructed breast. I will tell about it later because it's quite important and it's a thing that's very specific for our clinic. But for breast cancer, well, Finland basically has one of the best survival rates in breast cancer worldwide, one of the best. Here are some statistics, and I need to say that these statistical data is very precise because they are not collected from hospitals. They are taken from cancer register to which each hospital has to report very precisely the numbers. So if you see after 1 year, almost all patients are alive, and after 10 years, 86% of breast cancer patients are still alive, taken into account all cases, also the cases when the cancer has metastasis. It is one of the best survival rates worldwide, and one of the reasons is very good screening programs. It means that cancer is detected mostly on the very early stage when it can be successfully treated. Also, good aftercare and good surgical treatment stage is one of the reasons why we have these good survival rates. When we need to perform reconstruction of a breast, so in those rare cases when we have to perform mastectomy to remove the whole breast or the most part of the breast, we speak about breast reconstruction. And there are numerous methods how we can perform this breast reconstruction. It's very personal, it's very tailor-made, all this planning of this surgery. It depends on what a woman wants to achieve. Does she want to have the same looking breast as she had before cancer? Does she want to maybe to have bigger and more beautiful breasts than she used to have? Or maybe she wants to have smaller breast because she has dreamt of breast reduction for years, and now she has the opportunity to have it. But the most challenging cases are when we have to remove the whole breast. So then we will speak about breast reconstruction. There are different methods. Of course, the first thing that comes to your mind maybe when you think about breast reconstruction is implant, reconstruction with implant. It is also possible, and Helena Puonti can eagerly perform this type of reconstruction if the patient wants that. But what we really recommend is reconstruction with the patient's own tissue. And here we see the wide range of different methods which are available and which could be discussed, and you can choose one of them. Again, depending on the starting situation, depending on how much own fat tissue the patient has, because sometimes when the patient is very thin and she does not have enough fat tissue, then maybe implant is the best option. But in most cases, we all have some fat somewhere, and we can use it, and we can perform very naturally looking, we can achieve a very natural looking result. So reconstruction with own tissue. One of the best is so-called free flap reconstruction. I already mentioned it. It is called TRAM, and it's quite known worldwide. It means that, so it is microneurovascular muscle sparing TRAM reconstruction. Other option to this is DEEP. And also we have the flaps taken from the back. LD flap, for instance, is one of the most typical one. When we speak about TRAM, the free flap is taken from the lower abdomen area, so from the lower part of your belly. And it is a free flap. It means that it's removed totally, and then it is moved up to the place where the breast was removed. And the LD flap is a different one. So it is one that is not taken totally, but it is just turned from the back to the front to perform, to make a natural looking breast. I would like to show some examples later, but I will just list other options. So sometimes we can mix the methods. We can use, for instance, the LD flap, so this flap from the back. But when the patient does not have much fat tissue under the skin on the back, then it is very good to add an implant under this flap. So of course, the size of the implant is chosen according to the size of the other breast and according to the wishes of the patient, of course. And the last in this list is fat transplant. It allows to correct some minor asymmetry changes in the breast. Only with fat transplant, you cannot achieve a big breast. So more about the sensing breast, which is the developed version of this TRAM, or microneurovascular technique in breast reconstruction. So it is microsurgery. It demands special equipment of the surgical room. It demands microscopes and quite a big team working with the plastic surgeon. Here are some technical details what we're going to do. So as I have already said, what is dual TRAM? What is muscle sparing TRAM reconstruction? It means that we take a free flap from the lower abdomen. You can see it here on the picture. Here we have this flap that is going to be taken up here for the breast to be shaped here. Of course, the first task of the surgeon, which is very typical for this TRAM reconstruction, is to connect the blood vessels to restore blood circulation here. It is for sure, but Helena went further. And she started to develop this method so that she also connects nerves. after connecting nerves, so after this free flap is taken here up to the spot where the future breast will be shaped, she connects the nerves around this flap. The nerves are connected using this protective tube. Here you can see the nerves. Neurography is the process of connecting of these nerves. Because nerves being cut, they have a tendency to become fluffy on the end. If you can imagine, when you cut the nerve, the end of this nerve becomes fluffy, and it can cause pain conditions. When the nerves are connected, either end to end or end to side, and with the use of this protective tube, you prevent this fluffing. So the nerves can be really restored. And after a while, normally after several months, the sensing returns to this free flap. So if we speak about traditional TREM reconstruction, which many surgeons in the world can do, well, not maybe many, but very, very good surgeons can do, they can make even an ideal shape of this breast, which will be warm because blood circulates here, but it will have no sense. It means that it will become numb for the rest of the life of this woman. And actually, even only this sensing breast method allows the nerves to be connected and the nerve sensitivity to be restored. It is a very hard task for the surgeon. It demands long experience in this area, but it is totally possible. So why have a numb breast when you can have a sensing breast? It means that you can feel warm, you can feel vibration, you can feel touch to the skin of this breast. And it means that this breast, the reconstructed breast, is not felt like something that does not belong to your body. It means that you forget that it is reconstructed. You feel that it has always been there. It's the same, almost the same breast that you used to have. Well, and I think it tells quite a lot of things about the quality of life of such woman. Here we have some examples of this sensing breast method. Well, here you can see that the woman before, just a moment, when we take this free flap from the lower abdomen, at the same time, woman receives abdominoplasty. Well, it's kind of a bonus to that. So, of course, there will be a scar, but this scar stays under the bikini line. So actually, it does not affect anything. And of course, scars can be treated afterwards. And here is the reconstructed breast, the reconstructed with this method. Here we have the result after 2 years, and the sensitivity, nerve sensitivity, is restored in this breast. The second breast in this case was reducted because the woman wanted that. And after 2 years, you see this scar in the lower abdomen, which is under the bikini line. And well, actually, it is not seen. Another example of this with a smaller breast, and also here is the plan of the surgery. Such a big flap is taken, and then it is stitched together. And again, here is abdominoplasty at the same time as a bonus. And here we have the reconstructed breast. I think it might be around after a year after the surgery. Well, different situations and different shapes. Most of the women want to have the natural shape that they used to have, because many people who encounter the cancer, they just want their previous life back, and maybe they do not want anything new. But for them, it is important to understand that they are the same as before cancer treatment. I can explain why here you do not see any scars. In this situation, it is a bit different TRAM reconstruction. Again, the flap from the lower abdomen was taken and the breast was shaped. But So the cut was done around this mamilla, and this flap was put inside the breast, under the skin, to fill this breast. Because in this case, this particular breast cancer case did not demand to remove the skin of this woman, the skin of the breast. So we only removed the gland inside, and then we put this free flap to fill this breast. So the scar is only around the mamilla. Then again, just a reminder that when we make a breast reconstruction, we do not reconstruct the mamilla at the same time, but we do it later, and it is a very simple procedure that can be done in like half an hour. Here, it is not a tram, it is the example of LD reconstruction. So the flap was taken from the back, and as you see, this woman does not have much fat tissue, so she's quite thin. And a small implant, very, very small implant, was put under this flap to reach almost the same size of the breasts. Well, besides that, Helena Ponti, being a very experienced breast surgeon, she performs all possible types of breast surgeries. Here we see the example of mastopexy. So when during aging, after breastfeeding, after pregnancies and so on, it is very typical that the breasts of women fall down, and well, it demands some mastopexy. If woman wants, it is very simple. Well, simple. It demands experience, of course, but it is a procedure that is totally possible, that we lift the breasts so that they look young again. And the incisions are made normally around the mamilla, so it does not affect the total look. Reductoplasty, the reduction, breast reduction, becomes more popular all the time. We have noticed that more and more women with big breasts want them to be reducted, again, to make the quality of life better, because they are tired, they have back pain, and they have different problems. They cannot do sports, and they want to be more active. They want to move actively. And then again, big breasts have a tendency to fall down, and so you can achieve the lift and to make the size of the breasts smaller with this brilliant surgery. I have noticed as a patient coordinator that maybe breast reduction patients are one of the most happy patients that we have. They are so relieved and so happy after this surgery. Also, of course, we perform different types of breast augmentation, breast enlargement with implants. Helena Ponti makes breast augmentations with two different methods. The first one is a traditional one, when the incision is done around the mamilla. And the second one is the endoscopic method. It demands, again, great experience, and it means that on the area of the breast, we make no incisions at all, and we reach the breast, the inside of the breast, through the armpit. A very small incision in the armpit allows to place the implant inside the breast, so no scars on the breast area. Very good looking result. Well, also Helena performs different surgeries on the body area, abdominoplasties. Here is a traditional abdominoplasty, not related to this TROM breast reconstruction. And she performs facelifts, facelift with a SMAS technique. Another example of facelift. It could be very good for different ages, maybe starting sometimes from 45 and up to maybe 65, 70 years. Well, actually, it is the end of my presentation, and I would be happy to answer your questions. I will be happy also to send the contact details and otherwise some written letter to all of you who was interested in us. We are eager to work with medical agents throughout the world. We are easy to reach. Tampere is very easy to reach, and we will be happy to help with different traveling organizations and if necessary, interpreting. But as I said, we do not need interpreters if the patient speaks Russian or English, because these languages we have here inside of our stuff. Well,
Yeah.
thank you.
Very
Thank you
much.
very much for your attention.
It's an amazing presentation. Yes, and we already have first question here. Please, colleague, write your questions because Ina, she's very limited in time. She's already in the operation room, actually. So please, let's do everything dynamic. So dear Ina, thank you for the excellent presentation. We are very familiar with Clinic Helena's work and have had a positive experience. Our previous patients received incredible professional medical care combined with the truly family-like attitude and support from the interclinic staff. However, we unfortunately lost contact with previous international department manager and we are unable to refer new patients. Therefore, I am happy to present this seminar and reconnect. Thank you and thank you. So, what about questions? So, I have questions. So, Ina, can you compare the cost of treatment in your clinic and in German ones?
With the German?
Yes, for example.
Actually, I haven't followed the prices in Germany during the recent years, but of course I can give you the information about the prices here in Clinic Helena. So when we speak about this TRAM reconstruction, so the sensing breast free flap reconstructions from the lower abdomen for this breast, of which I spoke during this presentation, it is 48,000. We speak about euros, in euros, of course. It is our prices. So when we make a cooperation agreement with medical agents, we discuss this price again, and we discuss the percent that should be added to this price for the medical agent. Then the LD reconstruction, the one that uses the flap from the back, when it is performed on the one side, so when we need to reconstruct only one breast, it is 25,000 euros, and performed for two sides, sometimes you need two sides in some cases, it will be 32,000. The breast conserving surgery. So when we have a breast cancer diagnosed and we need to make this breast cancer removal, performing it with the oncoplastic technique or performing a mastectomy for the future reconstruction, it will be 16,500 euros. This price actually hasn't changed for several years. And I think it is quite competitive on the market in Europe. Any other questions for the prices?
Yes, we have questions, many questions from Tatiana regarding contact details. Everyone will get contact details of Ina Latina.
I will be happy to provide you with the contact details.
Everything you can send to her and coordinate with her. And I will read another question. So now, do you have your own operating room or you rent from another hospital?
No, we do not rent. We have our own operation room. Actually, I'm sitting inside this operation room because we have a lot of patients today in the clinic, and I just wanted to find a quiet place to perform this presentation. So I actually am here. I'm not sure if you see me, but
Yes.
maybe if you do, then, well, I'm actually inside this operation room. We have our own premises. So we can do everything here. For the diagnostic, we make cooperation with a bigger chain clinic, Terveystalo, which is in the same building, but on the second floor there, upstairs. And they have all the diagnostic equipment, the MRI, the mammography, the ultrasound. We have ultrasound too, but all others things that we need for the diagnostic, we can order from them, so you do not need to leave this building.
Okay, you already answered on one of questions. So next question. Hello from Romania. I want to ask you, how long should stay patients in Finland after surgery?
It is a great question. Yeah, it is important when you arrive from abroad. And let me answer that. Of course, it will depend on which type of surgery we're speaking about. Because TRAM is, so the sensing breast TRAM is a very demanding surgery, which means that the person will stay in the hospital, so in our clinic, for at least 3 or 4 days. After that, the patient will be still observed by us daily, but the patient will already live somewhere in a hotel or in an apartment. But the overall follow-up period will be at least 2 weeks. But of course, when we speak about the breast cancer surgery, I mean the oncoplastic breast cancer removal or the mastectomy, it is much easier surgery, which does not demand even overnight stay in clinic. So if the surgery is performed in the morning, then the patient is observed here in the clinic till the evening. Then the patient will go to the hotel or to the apartment, and then we will meet daily again in the clinic. But the studies in Finland has shown that mobilization of the patients is very important. It improves the healing process, and so we do not want the patients to stay in bed for a long time if it is not necessary. In the case of sensing breast TRAM, it is necessary to stay in bed for like at least 3 or 4 days, still moving around the room, but not leaving the premises of the clinic. So, well, it depends. But normally, when we are expecting a patient from abroad, we want to make sure that all possible aftercare care is performed here. So if it is possible, we want to remove stitches after the surgery. It is done, let's say, after 8 or 10 days after the surgery. And it is the best thing that the patient stays here in Tampere, so nearby us, and if necessary, daily sees the surgeon till the removal of stitches. Then we can be sure that, of course, it is possible that, you know, sometimes we see a kind of a busy businesswoman who wants to get back home and then to keep this remote connection with us, and she will arrange stitches removal in her home place. But everything is possible, but what we recommend is to be ready to spend 2 weeks here in Finland, at least 2 weeks, if we do not need diagnostics, because sometimes when we need to perform the final diagnostics beforehand, then of course we will need some time for the diagnostic procedures to be performed.
Thank you. And the question, how quickly you answering, giving offer to clients when you get all documents?
Well, when we have medical documents, and if we think that in these medical documents everything is clear and does not demand any further diagnostics, I think then within 2 working days we are always answering. I would even dare to say that within 1 working day, because we are here performing work, but well, so our team needs. I just need to get in touch with Helena and our oncologist, and the answer will be received. But just to be sure, I will say that 2 working days.
Thank you. And next question: do you have collaboration with hotels near hospitals, and also do you provide transfer for them?
We have an agreement with Scandic hotels. One of the Scandics is just opposite like 50 meters from our clinic, and other Scandics that belong to the same chain of hotels have the same cooperation agreement with us. We have a discount there. So we provide our patients with the code using which the patient has a discount in the hotel. But actually, all types of accommodation are possible. Sometimes when a person arrives with someone, with some family members, for many people, it's more convenient to stay in some apartment, and then we will just assist with finding this suitable apartment. Again, it's very individual. And you asked also about transport. The logistics to Tampere is very easy, really. We have an airport. It is an international airport, and it has connections with many European cities. And even if it does not have a straight connection to your city, at least through Helsinki, you can fly to Tampere. Also, we have a railway station. So from Helsinki, it is 2 hours by train or 2 hours by car, if you rent a car, for instance. So it's very easy to reach, and we will assist and give instructions just depending on the situation from where the patient is traveling and or what are the needs, or what is the company accompanying the person, and so on.
Thank you. What is the complete list of mandatory documents and test results in English that must be submitted for clinic to prepare preliminary medical opinion and treatment plan?
Do we speak about breast cancer case?
I guess yes. I don't know.
Okay, well, it depends on what has already been done, because sometimes I would say that in many cases we receive the first contact when there is a suspicion for breast cancer. So, for instance, a woman has been at an ultrasound examination, and the radiologist found a lump there. The lump looks very suspicious, and a woman has said that you need further examinations. And then the woman already knows that, okay, unfortunately, there is a strong possibility that it is breast cancer. I need to look for options. And if she also is considering treatment abroad, on this stage, she can already contact us. And then we will guide her to make further examinations, because further examinations must contain also mammography, and in some cases also MRI, but not necessarily actually. If the ultrasound and mammography give the same results, then not necessarily MRI is needed, but sometimes. Well, the final diagnosis is made only in pathological laboratory. It means that biopsy should be taken and examined. If it is already done on the homeland of this person, then we can consider it diagnosed finally, and then actually we just need the either on English or on Russian or in Finnish, but barely in Finnish. We need the statements for this pathological PAD examination for the biopsy, and also the statements for the radiological examinations performed, like ultrasound, mammography, MRI. Actually, we will anyway, before the surgeon, we will take some blood tests. We do not need them in advance, so we can perform them here. But I think this is basically the main things that we start from. So we either should confirm that we already have these diagnostics performed somewhere else, or we will guide the patient or maybe invite to perform these examinations here at our clinic. So many people choose this way because in some cases they do not trust the medicine, the equipment, and well, name it, in their country of residence.
Thank you. And next question. Am I correct in my understanding that we can refer patients for aesthetic plastic surgery? Yes?
Yes, also, yeah, I just mentioned it very quickly in the end of this presentation, because Helena Puanti performs these too. But we just wanted to focus on something during this presentation, and as it is our main Main thing that Helena Ponti does is breast cancer surgeries and breast reconstructions. This is why I emphasize it during this presentation. But besides it, she performs aesthetic surgeries, and of course, patients are welcome also to have those abdominoplasties and breast reductions and so on. As I just had to say that breast reductions are so great because many women dream of them. But of course, if you have a patient that is interested to be operated by a very experienced surgeon, then warmly welcome to Clinic Helena.
Thank you. And one question you talk about, but maybe we need to repeat. What about language barrier? How do you manage? Do you have translators for international patients?
Yeah, I actually already mentioned it. Helena Ponti speaks Finnish as a mother tongue and English. She can perform. Also, she speaks Swedish, but I don't think it is the case that will help your patients. But well, these three languages that she can speak without translator. Then we have me, who is a patient coordinator, and actually my education is a medical translator, medical interpreter, and I can work with Russian and English and Finnish. So these three languages. And if our patient speaks some other language than the one mentioned here, it means that we can organize a translator. For instance, by the way, I'm sorry that we have this Chinese website here on the slide. We had to change it, but it is the sign that we are cooperating also with Chinese hospitals, and this is why we have this Chinese version. But what I wanted to say is that, for instance, when we have Chinese patients, of course we do not speak Chinese, but we have Chinese-speaking nurses here living in Tampere, not working in our clinic, but we can order their services for the days when the Chinese patient is arriving for a consultation, for treatment. We want the patient to feel safe, and me as a foreigner myself here in Finland, I know that it's very important that if you do not speak the language that is spoken around you, you do not feel safe. You need someone who speaks the same language with you, and we will do everything to arrange it. For instance, if we have this Chinese patient, a Chinese woman who does not speak any language besides Chinese, we will invite this Chinese nurse to be with her on the consultation, then on the day of surgery, in the morning. So the nurse will come and will hold her hand and will translate what the doctor and the nurses are speaking to this patient that is going to be operated today. And then when the patient wakes up after the surgery, the nurse is again there speaking with her, because the patient can be scared after waking after the surgery. So it's very important that the language is available, and we understand it, and we do everything to make sure that it is done.
Thank you, Ina, for your great job. I'm impressed very much, actually. And thank you, everyone who came and who participated in Global Health Tourism Show. I wish you good cooperation and satisfied patients.
Thank you very much. Thank you for the attention of those who arrived, and I will be happy to send you some emails with our contact details. And please contact us, and we can arrange a separate call time, maybe Teams or Zoom, just to speak more about our cooperation. Thank you.